Namaste and welcome to our second session on yoga therapy. Let's begin by finding a comfortable position, allowing your spine line to lengthen slightly, and then noticing that when the spine lengthens that you can relax your shoulders and release tension from your face, your jaw, and your neck. If you're comfortable doing so, you can place the hands at heart center. Inhaling. Yogena chittasya padena vacham malam sarirasya cha vaijakena yopakarotam pravana munina patanjalim pranjala Ranatoshmi Habahu Prushakaram Shankashakrasi Darinam Sahasra Shidesham Shwetam Pranamami Patanjalim Aum. So let me begin first by truly commending all of you for your wonderful discussions and inputs in the forum discussion. I had a wonderful time reading about how you practice yoga, and I think I'm very lucky to be in your presence, to be studying with you. Truly, all of you are wonderful yogis, and I see that you're going to make wonderful Ayurveda counselors and practitioners as well, based on your dedication to the Vedic sciences. So today I'm going to move through a couple of different slides. Please give me information via the chat if you find yourself lost or if I'm going too fast for you. But we're going to focus today on the third limb of Ashtanga Yoga, asana. We'll learn about the benefits of yoga, asana yoga, and learn the basic pillars for the application of yoga therapy. We'll also learn what vinyasa, hatha, and basic yoga is. So before we move forward, let me escape from here real quick. And we're going to look at exactly what is yoga therapy. We talked about what yoga is, and I think we have a wonderful idea about that. But what about this yoga therapy that we're going to be studying and applying? Let's begin with the idea that yoga therapy is the process of empowering individuals. I love this definition by Richard Miller because it really speaks to the idea of helping people be the strongest person they can be, helping people find their own inner strength in order to find balance. So the process of empowering individuals toward improved health and well-being through the application of the philosophy and practice of yoga. I think what's important here is to distinguish that yoga is a philosophy first and foremost. It's not a religion, and it isn't in of itself just a physical practice, as you all know very well. So moving forward then, let's take a look at this definition. Yoga therapy may be defined as the application of yogic principles to a particular person with the objective of achieving our particular spiritual, psychological, or physiological goal. What I believe is important in this definition is that yoga therapy is suited for a particular person. Although sometimes you may give a class for yoga therapy, for instance, a class that's suited for people with back injuries or knee injuries, that sort of thing. But for the most part, yoga therapy is for a particular person. In seeing and sensing that, remember that the objective is to achieve a particular spiritual, psychological, or physiological goal. But there again, it's going to really depend on who your patient is, who your client is. Some people are not open to the spiritual practice of yoga and really don't want to open up about their own spiritual practice in general. So we have to be careful that we don't move into arenas that aren't comfortable for the particular client. More about that later. And then the psychological goal. Well, what would be a psychological goal? In my view, all of yoga is psychological. All of Ayurveda is psychological. Everything moves through the Ayurvedic mind, right? Everything moves through the Western brain as well. In my view, when I'm helping people in yoga therapy, I'm really helping them with the psychological aspects of their mind and the psychological aspects of their practice. Of course, most people will come to you with the idea that they need help physiologically. Something is out of balance in their physical body that is causing them discomfort. And usually it'll be classic things like a hurt knee or a hurt shoulder or a sore back. But as you move into yoga therapy, you'll also see that you'll be able to recognize how to help people through yoga therapy with things like imbalanced menstrual cycle or with so many other things that are physiological in nature and not just, for instance, a sore knee or a sore back, that sort of thing. And then moving forward into the purpose, and this is going to be really where we move forward through the rest of the class. So it's going to be important that you take note of the purpose of yoga therapy, and that is to balance the 5 values. Secondarily, to balance Agni. And thirdly, to balance the flow of energy in Sushumna, Ida, and Pingala Nadi. And of course, we'll speak and discuss, especially in the forum, as it regards to balancing Agni this week. So take note of that in particular, but we'll move forward with that today. So if we look towards balancing, let me get this one up right for us now. If we look towards balancing energy, prana, any of the vayus or Agni, we first must understand a few things. So what is it? We first have to understand, if we're going to be using asana for this or the physical practice of yoga, well, what is asana? Asana, of course, as many of you probably know, means to sit firmly. Patanjali states in the second book of the Yoga Sutras that asana is a steady, comfortable posture. As you'll see, asana is going to mean different things for different people. What is a comfortable, steady posture for you is going to be completely different than what is a steady, comfortable posture for me. But in essence, we want to remember that asanas were developed to aid in sitting in quiet meditation. So when we're picking asanas for a particular client, it's important that the client is able to maintain that posture for a good amount of time. A good amount of time for me is at least a minute. I don't often give yoga therapy, asana posturing to clients that requires them to remain in the posture longer than 1 to 3 minutes. The reason for that, of course, is most people won't adhere to something that's difficult, or they won't adhere to a posture that either bores them or puts them in a place of too much inner contemplation or too much pain. But most people can adhere to 1 minute a day of something. And what I've found is that 1 minute a day, this continual practice, is more important than doing something 20 minutes one day and an hour a different way and then not doing it for a month. So it really is important to remember to start out slowly with the clients. Well, the benefits of yoga, of course, include improved flexibility. What most people don't understand is it also requires or entails improved strength. We'll have improved strength with the practice of yoga. And when we're practicing or giving the yoga therapy to our clients, it's important that we take into account both flexibility and strength. So if you're doing one thing to the body to make it more flexible, more lax, you must understand that the opposite side of the body, of course, is going to be strengthening. So we want to make certain both sides of the body are equally balanced. If you give something to one side, the opposite side is also going to be invigorated, either by stretching or by strengthening. I'll give you an example of this. Many times people come with a sore back or an injured back even. They may have had a surgery that's gone awry, or they may have narrowing in the discs, or they may have growths or arthritis, many number of things, spondylolysis, spondylolisthesis, this hardening and narrowing of the spaces between the vertebrae. So you'll have many people, I think backs may be the number one thing that I get complaints from people coming to me for help. Well, I have to take into consideration, first and foremost, what is weak within the area of what Westerners call the core. The core, of course, is compromised of the muscles of the abdominal area, rectus abdominis, the internal and external obliques, and then also erector spinae, the muscles of the back. So in taking into account what is weak of that person, what I'll usually do is I'll have them perform, for instance, a bridge, a very simple bridge. And people with very either tight hip flexors, the muscles in the front of the legs, quads, and very weak core muscles, those group of 4 muscles I just mentioned, will have difficulty performing a bridge. Well, that will tell me immediately that the muscles, you noticed I said that the muscles of the quads and the muscles of the hip flexors, iliacus and psoas, those are tight. But weakness is going to appear in erector spinae, in the internal external obliques, and in the rectus abdominis. So it's going to be important that I stretch out the quads and the hip flexors, and some very easy postures for this would be assisted heroes, of course, putting a block underneath. I don't really like hero too much for yoga therapy, but if it's done with a block or a blanket to support the knees, it can be a very effective pose. Long story short, moving on, we don't only want to then bring flexibility to those muscles that were tight. Now we need to strengthen the back as well, and the front of the belly and the sides of the belly. Well, how might we do that? One of the best poses, I think, and safest poses are the planks on the elbows and the plank on the side, the forward plank and the side plank. So there you have it. You've created a yoga therapy routine for someone with back pain. Now, of course, stretching the quads, there are myriad of poses that can be used to stretch the quads and the hip flexors. And that would be for you to figure out what's best for your client. And there are probably hundreds, maybe thousands of postures that would be good for strengthening, all at the same time, the muscles of the core that I talked about. So this is what the yoga therapist starts to do. They start to look at, number one, what's weak and needs strengthening, and number two, what's strong, overly tight and needs stretching. So in that way, you begin to create balance of the musculature, and in that sense, you begin to relieve pain. Well, the benefits of yoga, of course, move through and beyond just flexibility and strength. They also include improving balance. And I think especially for the aged population or those with brain or neurological conditions, improving the balance is going to be a big thing to do. But if you just step back again, for instance, in improving balance, say someone is having a hard time simply walking. Their balance is off. They're having a lot of stumbling, a lot of falls. You want to look at which muscles are weak and which muscles are strong. Normally, the muscles that are weak are going to be the muscles that are in the inner portion of the legs, the adductors, and the outer portion of the leg, the abductors, the stabilizing muscles. Those small muscles are going to be strengthened by just doing simple balancing postures like the tree. And we'll talk about that later. The benefits of yoga include to reduce stress and anxiety. Just practicing pranayama is going to help that. The breathing practice alone. Helping someone breathe in the belly center instead of the high chest is going to help. For me, every client that comes in for yoga therapy to my practice, we practice pranayama. In my view, there's no healing without a calm mind. And certainly when we're doing a yoga therapy session, pranayama is going to be a big part of it. Increasing energy. When the flow of prana is balanced, when the vayus are balanced, well, all of it really, Agni as well, but specifically I'm speaking of prana, then we can feel and sense the increase in energy. Of course, the practice of pranayama, which we'll talk about more in next class, is really going to help people achieve this increased level of energy. It helps decrease fatigue as well, reduce sleep disturbances, and reduce hypertension. I have an elderly client now with pretty severe hypertension, and she came to me a few weeks ago in a pretty big or pretty bad way. Her blood pressure was very high, and all we did was lie down, take some aromatherapy, and practice pranayama. And looking at her blood pressure just completely drop was a beautiful thing. So remind yourself that the number one thing that we can do for people immediately as yoga therapists is rely on these beautiful tools of the breath and of asana, which we're going to be specifically addressing today. Have I gone too fast? Is everyone feeling like you're understanding this more? Creating balance through flexibility and strength, making certain that you just don't give stretching poses, but that you give strengthening poses as well. Recognizing that pranayama is an important part of the practice. Good. So let's talk about yoga therapy applied in the sense of how Krishnamacharya, the great yogic sage and Ayurveda practitioner, saw it. Krishnamacharya saw it as a Vedic philosophy that's based on the sutras of Patanjali. So he saw and sensed and felt, I'm sure practiced, that yoga therapy could be a philosophy to some people, and just that. So there are people who will come to you where you will just use, for instance, the sutras maybe. You'll sit in a session with them and go through the philosophy of the sutras. I'm doing that with someone right now. It's a beautiful way for people to get a grasp on, we'll just go back to the second sutra, to the turnings of the mind, right? It helps people acknowledge where their mind is at a specific point in time, not just while you're studying with them, but in their whole life. The specific client I'm talking to you about, we're going through the kleshas, the obstacles, and it's helping her tremendously decipher, sense, feel, become aware of why she has sleep disturbances, why sleep disturbances are so much a part of her life. And of course, one of the kleshas is sleep itself. But what I'm moving through here is that we have to make certain that we understand that whatever yoga therapy we give or practice with our clients is completely suited to the individual. It isn't something that we predetermine. Oftentimes, it's something that happens organically, and that is something that happens organically, of course, through the process of your interview with the client, your first session. Yoga therapy can be looked at as a physical culture, and sometimes even an art when you use asana. I mean, it's very beautiful, isn't it, asana, especially an adept practitioner. Sometimes you'll have clients that are very strong and very flexible, and it suits them well to take the asana as their main mode of therapy. You may use yoga and yoga therapy as a curative or preventative option, where you really use it as an aid to balance, of course, the Vayus and Agni. Again, it's going to be highly determined on the individual. And this is where we come to Yukta Shikshana. So this is what is specifically acceptable, or should I say preferred method for the individual that you're dealing with. What's appropriate for the individual? Choosing that is going to take into account Veda, the differences between people. Some people are very religious and don't want to have any mention of the philosophy of it, the spirituality behind it. Some people may as we just talked about, be very strong and flexible, and asana may suit them best. For that matter, some may be very weak, and maybe asana would be the best thing for them. But it's really taking into account what's appropriate for the individual, yukta shikshana, and then beta. What are the differences between individuals? I can't just have a file of yoga therapy and then just use those 3 or 4 things for everyone that comes through the door. We really have to take into account the differences amongst people. And then deha. Deha, of course, takes into account a lot of things, mostly the dosha, the age of the individual. Who are you dealing with specifically? Are there areas that you may not want to delve into because of this person's dosha? You may not want to practice at the middle of the day asana practice with someone that's very strong and flexible. You're thinking, oh, asana is perfect for this person, but there are appointments in the middle of the day at noon. Well, their dosha, on top of that, might be their pitta dosha. Well, we wouldn't want to then give them asana practice at that time of day, would we? So we have to take into account the age, their dosha. This is deha. Kala, we have to take into account time. I mean mostly here the time of seasons. So what time of year is it? Is it the fall? Is it the summer? Should a pitta be doing vigorous asana in the summer? Probably not. Should a vata be doing kappabalati in the fall? Definitely not. These sort of things are what you want to think about. This is the process of what you're going to be moving through as you start to apply yoga therapy. Excuse me, I'm going to take a drink of tea. The next thing we'll think about is vritti. For this, we're speaking mostly about occupation. Many people will come to you who have desk jobs. I like to use kind of Pavlovian cues for people who have desk jobs. And what I mean by this is I say, well, every time you hang up the phone, for instance, take a spinal twist in your chair. Every time you go to the restroom, hold down to the countertop and do a tabletop with your back. Every time you look at your emails, you may want to press the hands backwards to ward off carpal tunnel. So giving people, knowing that people are going to be seated at their desk for a long amount of time, the last thing people want to do when they get home from work, even if they need it, is to practice a big asana class or to do something that requires a lot of work. So if you can find times throughout their day that they can do things and they're cued by the things they're already in habit of doing, it usually helps people get very accustomed to integrating yoga therapy into their life. When I lived in California, and there were many, many freeways and a lot of busy traffic everywhere, and people would be in traffic, up to an hour just going to work, I would say, okay, every time you come to a light, practice your belly breathing. Every time you do this, so you can give people cues just based on what their occupation is. This is a very important consideration. Shakti, we want to be certain that We know what a person's energy level is and what their endurance is, what they're capable of handling. I have a few clients now that have neurological disorders, and if they have memory problem, am I going to give them something that requires a lot of memory to it? Well, that might be a yes, no, maybe so kind of an answer. Yes, they need it, but I have to make sure that I don't overwhelm the client. So knowing what a person's endurance is very, very important. And I don't just mean, their cardiovascular endurance. I mean their physical endurance and their mental endurance as well. And then Bala, we've been talking about this a lot, a person's strength. Person's strength, of course, their strength can be increased through the practice of yoga. And I believe the practice of yoga helps all ailments, but especially those where people are weak. It's a beautiful way to increase strength in people. Unfortunately, most people just see yoga and yoga therapy as something that makes them bendy. I had a new client this week that says, I don't want to do any yoga. I'm already flexible. And so, of course, then educating the client, yoga therapy isn't about being bendable. It's about creating balance. And this lady, in fact, definitely needed to be strengthened in certain areas because she was having horrible back pain. So this is how you start looking at how to apply yoga and yoga therapy. Marga's the last one. And it might be the most touchy, especially when you have your own practice and you might have someone come in that you know nothing about. For instance, so when I first started my practice of yoga therapy, maybe 20, 30 years ago, I would have clients that were my personal training clients. In other words, I was training them to lose weight and to get fit the Western way, with weights, running, bicycling, that sort of stuff. And then I start integrating yoga with these people to help them find balance, more importantly, of the mind, body, and spirit. I can remember one client in particular was a Jehovah's Witness. And the moment I mentioned that I was going to do some yoga with her, she didn't want to have anything to do with it. And I had to really be careful that I didn't introduce anything into her workout routine that had anything to do with the philosophical nature of yoga. So those people, what I was saying is that the people that I had back in those days, I knew them very well already, and I knew what to stay away from. You know what I'm saying? I knew that this person was very religious in her own way and didn't want to have any mention of yoga. Well, sometimes you'll have people come to you and you know nothing about them. It's the first time you see them. They come to your practice. And you have to be careful that you ask the right questions and that you don't assume that you're going to do a certain kind of practice for them, because you could put them off. And asking the correct questions, of course, we'll go into in a later presentation. But it just all stems around doing things that are appropriate for the individual and taking into account these tenets of Krishnamacharya. Any questions or anything you'd like to share? Did you get what Marga is? Marga is a person's beliefs. It's not so much spirituality. It's more, their beliefs. And some people may say they're spiritual. Some people may say that they're religious. Some people may say, I don't even want to talk about it, right? So you just make certain that you understand what they are, their beliefs are, without putting them in an uncomfortable position. Everyone ready to move on? Okay. Vinyasa we're all pretty familiar with, I believe. Vinyasa stems from the root V in a special way, and nyasa, to place. Excuse me. In modern Western yoga practice, we use vinyasa to mean flow. Flow yoga, is it the best type of yoga to use for yoga therapy? And I'm going to hold that open for the chat for a moment. Would you use flow yoga for yoga therapy? Or is it the best type of yoga to use in yoga therapy? Can you respond to that? Do you think that's yes or no? I think the best way I can respond to this, Pamela says, it's not for all types of person. And what I'm going to put here is something that sounds flippant, but I'm not trying to be flip. I'm going to put it in the chat and then I'm going to say it, and you'll hear me say it a lot. Really, it's a yes, no, maybe so kind of an answer, isn't it? For some people, it may be the best. It really may be the best. You might have an adept practitioner who's practiced yoga for a long time, is very comfortable with it, and they would do well by having a vinyasa practice for their home practice that's therapeutic in nature. In other words, you choose the flow, you choose the sequence for it. On the other hand, it could be no, it's not appropriate. What if I have someone who's never done yoga before? That's the last thing I'm going to give them. But it might be a maybe so kind of question. It might be something someone wants to start into their life and incorporate into their life, not just for their specific imbalance, but they just want to do it maybe as a hobby or exercise in general. And then it's fine. Sure, it's fine to teach someone that way. But of course, it's always answering it means that you know who your client is and know what it is that they're trying to accomplish. So what is Hatha yoga? Oftentimes we have people in the West think of Hatha yoga as yoga that is slow. You'll see something on a schedule of classes and it'll say Hatha yoga at 6 o'clock or whatever. Well, what is Hatha yoga? Most people think of it as a slow, easy yoga. Really, Hatha yoga is all the yoga that we practice. Every yoga we practice is yoga, anything we use our body for. Hatha is the forceful yoga, using force. And when we use our muscle, that's the kind of force I'm talking about. I'm not talking about force, pushing on something really hard or pulling on something really hard. We're talking about the force used in kinetics, in muscular movement. So Hatha is this kinetic movement, this forceful action of the muscles, all yoga. Ha, of course, is the root or stems from the sun, the energy of the sun that is warm and vibrant, and Tha, which is the energy of the moon, which is cooling and relaxing. Remind yourself that when we're practicing the physical practice, any yoga that's using the muscles, that we have the balance of the energetics of the sun and the moon. And maybe even more importantly, that we recognize when to use the energetics of the sun and the moon in postures. Which postures are creating heat? Which postures are creating coolness, calm? And it's going to be very important as we move through yoga therapy that you understand the distinction between poses that are cooling, calming, and poses that are energizing and heating. Hatha yoga, the forceful yoga. So what are basic asanas? So we've moved through using vinyasa. Now we're moving through using hatha yoga, the physical body, the muscular. Now we talk about basic asana. What are basic asanas? Well, it always goes back to that first tenet. It depends on who your client is. We could apply the guidelines of Krishnamacharya, integrating the philosophy, the physical, or the preventative and curative methods of yoga. But more importantly, basic asanas depends on who your client is. So I'm going to, for instance, ask about, and we'll respond on the chat. Would child's pose be a good basic posture? Is child's pose a basic posture? And why or why not? And this is going to be the basis for our discussion this week on the forum. We're also, I believe, next week, we're probably running too long here. I'm not certain how long you would like me to take. Manju, if you'll let me know how long you'd like me to take today, if you'd like me to take a few more minutes, or if you'd like me to finish now. But we need to also move into vayus, asanas for the vayus, asanas for Agni. And I don't want to overwhelm you too much at first. So why don't we leave it at this? We'll start to discuss what are basic asanas. Start with the idea that it's going to depend on who your client is and that you must apply the guidelines of Krishnamacharya. And in that sense, I'm really speaking of applying these guidelines using Veda, Deha, Kala, all of these. And then I'd like you to speak to whether Hanumanasana, for instance, the splits, is a basic posture. Or maybe even in that sense, if it should be used, Hanumanasana, for yoga therapy. And you're wondering what Yukta Shushana is, what is appropriate for the individual. That's the one that you should really pay attention to. That's going to guide you the most in understanding how to prepare a yoga therapy for clients. Okay, so let's take a look then. I'm going to move into some questions. Anything anyone wants to talk about here quickly before we finish our session? Move on. Let's look at this one real quick. So is this pose a pose that would be good for people in yoga therapy? Is it a basic posture? Anyone else besides Pamela? Is this a basic posture? Well, let's move back to what this is the best way for you to answer. Yes, no, maybe so. Remember, who is your client? So for someone who's very strong, who's an adept practitioner, who needs to increase flexibility of the inner legs, kindle digestive, it's fabulous. It's fabulous. But it's not very good for some others, right? So we really have to be careful about how we answer.
So Devi, do you want me to play a little video on Iyengar yoga? They have a little yoga therapy video on YouTube.
If you'd like to, sure. We'll comment on it afterwards.
Okay, give me a second.
Iyengar, of course, is the master of using props, and props really help facilitate yoga for most people, but they're not always beneficial if they're used as a crutch, is what I like to say. If they're used in a way that keeps the practitioner from sensing and feeling their own body, if they keep the practitioner from gaining strength or flexibility. They help facilitate the practice, but they shouldn't be a roadblock to the practice. And tapas is still a great part of the practice. Remember, creating heat, that austerity, that really is a big part of it. So even though I started yoga in Iyengar many years ago and then later practiced Ashtanga, I love them both. I really believe that you, in yoga therapy at least, you have to be careful how you use props and who is using them. They aren't automatically the best things in the world, is my opinion. I don't see a video.